One. This is the Fresh Start Project, where we explore the growing loss of trust in social institutions and how we can break free from broken systems and move forward towards something better. I'm Christian Mislowick, and with me today is Dr. Taylor Burrowes. Taylor is a relationship coach who helps men and women vet potential partners and get into and maintain stable, happy relationships. She's a former therapist with a PhD in marriage, couples, and family counseling. And from 2013 to 2019, Taylor served as deputy chair of the Mental Health Commission of the Cayman Islands. So this was a government appointment in which she helped to determine mental health policy in her native country. Taylor, thank you so much for joining me today.
Yeah, thank you for having me. I'm really excited to be on your podcast because it's a different perspective, and that's really refreshing.
Yeah, awesome. And I've been following you for a while online, and I'm a big fan of your mindset and your philosophy. You always post really great advice and strike me as someone who always will stand up for doing the right thing, even when saying so it gets people angry at you, or if it's the unpopular thing to say at the moment. So I like that. I really admire that. And I really want to talk to you today because you have dedicated your career to mental health, but doing so along two very different pathways, it seems, as a therapist and now as a coach. So I really want to talk about that more. But first, before we get into that, I want to ask you about the state of mental health in our current culture more broadly. So what are a lot of people having trouble with in this day and age? And what seems to be some of the big sources of suffering and discontent that you notice when you're working with your clients?
Gosh, well, I think emotional dysregulation is definitely a good sort of catch-all term that describes, because it's not a pathology, right? Which goes into answering the question, what's the difference and the distinction between mental health practice and coaching? In mental health practice, you're focusing on pathology, whereas in coaching, you're focusing on education and, more on the healthier functional side of the spectrum of, from mental illness to mental health.
Right.
And so looking at preventing any kind of issues or just focusing on choice, like self-accountability and things like that. So the distinction is an important one. And so emotional dysregulation, I like to use that as a blanket term to capture just not being in an optimized emotional state, right? Just for the general global population. And that's really the incidence of and the gravity of that has become really troublesome, and I think we're seeing, unfortunately, I do think it leads to a lot more pathologies, whether they're formal and properly diagnosed or not. So yeah, I mean, there's a lot going on in current events, I think, that we can use as examples.
Yeah. Like, for example, like what's a good one?
Well, the things that come to mind are like, I call it the unhinged, because I'm not trying to trigger people, but there's a lot of really extremist behavior happening that we can observe. So, unfortunately, tragedies like the Uvalde shooter, I mean, this whole thing that's going on right now with the Roe versus Wade being overturned in the federal level, and the reaction from people. I mean, in my state, in Arizona, they're using tear gas already at the protest last night. I guess like pro-choicers stormed the Capitol or whatever.
Oh, wow.
I don't know. It probably wasn't the Capitol. I don't remember exactly which building it was. Maybe Congress. But anyway, it's getting really heated. And so people don't know how to confront their dysregulated emotions. They have very strong feelings and they don't know how to control their behavior. And they think that, or I don't know that they're thinking so much, but they kind of just turn to this violent, unhinged behavior to try to deal with it, to deal with that intensity of emotion. And there's a lot of other ways that they can handle it if they were more skilled at doing so.
Exactly. Yeah. I mean, kind of landmark decision in our country like that, which I think is good. I don't think Roe v. Wade was a good court decision back in the day, 73. And so when that gets struck down, it sends a message to a lot of people who think that they're on the right side of history, that, you know, they need to defend abortion, that they have a permission to misbehave and act in what you said, an unhinged way. And it seems like they're getting a lot of support and permission from some of our leaders at the national level, and just cultural leaders too. Like it seems like we're creating a lot of our own problems in this society. And I wonder if that kind of contributes to just the normal, what is considered a baseline mainstream state of mind.
Yeah, I mean, there's just also contradictions everywhere. And so you see a lot of hypocrisy, and that just creates a sense of chaos in general mental health, like the collective mental health of the global community. We're being gaslit by all of this contradictory information, and we don't know what is true and what is not. And nuance is lost, objectivity is lost. It's just complete utter chaos. But I speaking of the Roe versus Wade, there was somebody on Twitter that posted a threat. I don't know if you saw that. I retweeted it, but like a lot of people retweeted it and tweeted it. He said specifically, someone should line up all those Supreme Court justices and murder them or something like drastic. And then he ended up deleting his account, I think. But for someone to think that that is an okay reaction and that they actually feel justified in saying it, whether or not, like, we can't take for granted that he wasn't being serious, right? Just like the shooter in Texas. Like, if we see these warning signs, we need to treat them, as valid and respond and intervene in order to make sure that there's no, imminent danger to anybody. But ultimately, even if he wasn't serious, like, how is that okay to threaten people because you just disagree with them?
Right. Yeah. I mean, there's been a lot of protests outside of the Supreme Court justices' homes, like in Maryland and close to DC. And it just seems like the way we're settling matters of public policy now is it's not through the normal channels that are established in our Constitution and our local government level. It's to use power and threats of violence and fear, like attacking those nodes, those people who do have like their hands on the levers, and intimidate them. And how is that a reasonable or mature way of acting?
Yeah, I mean, it just seems like it's a play for power, for control, money, obviously, greed, all of those things, the like primal base human aspects of our nature. But I mean, I'm not a doom and gloom person. I absolutely am I call it a grounded optimism or a realist, idealist sort of situation. My perspective is kind of in the middle. But I mean, I just think that it's hard to trust, obviously, going back to the purpose of your podcast, it's hard to trust these institutions. And I, to be honest, like, I'm American by default, but I am a dual citizen. I grew up in the Cayman Islands. So my government has its own problems, but it's very different. And I'm also not like totally, I'm not up to date on everything in regards to American government systems because of that, because I grew up in a different system myself. But I've kind of in my older, wiser age gotten up to speed, and so I know the basics. And I voted last time and the time before that, and but not until later on in life. So these kinds of civic issues and politics hasn't ever really been my strong interest area. But I know you wanted to ask me about like serving for the Mental Health Commission in the Cayman Islands. So I did end up getting into policy because of that. And I think I've always been opinionated. I mean, I'm not sure when or how to characterize that development in myself as just my own personality. But I think I've always been very outspoken, and I haven't always been that concerned about being in agreement with people or pleasing people. That was never my issue, really. I think if anything, it would have been just a lack of awareness of myself when I was younger, and projecting more of an image of myself that was, I don't know, maybe more polished or more academic. I kind of projected this image of playing the role of therapist. And that's one of the reasons why I left, is I grew as a person, and I realized that my personality it encompasses a lot more than just that academic, quote unquote, like professional side. And so I really enjoy how I'm bringing purpose into my life now as an independent, self-employed person.
Right. That's really cool. So you feel as a coach, as opposed to a licensed therapist, you have more freedom to be yourself and to not have to put on this mask, this professional mask. Is that right?
Yeah. Well, getting into that therapy, and obviously there's going to be a range of experience between, one therapist and another, but generally speaking, there's a lot of pressure on you as a therapist, like a mental health practitioner, to always be on. It's not like if you go to see a doctor for like a chiropractor or a gynecologist or whatever kind of doctor you go see, ophthalmologist, when you see them out, they're not, you obviously don't expect them to be doing their function out there while you're socializing.
Out of the office.
Yeah, because they're not, they don't have their tools. They're not examining you, but therapists interact with patient/clients through conversation, through interaction. So when we're socializing, people associate us in the same way as they would in the therapy room. Does that make sense? Do you understand what I'm trying to say?
Yeah, I think so.
Our modality of treatment is human interaction.
So you can
observation.
You could never slip up.
Right. It's a subconscious sort of expectation and projection that people just, they feel like if you say something insensitive or you reveal something about yourself that they didn't know, oh my gosh, like that's totally inappropriate. Like I'm not working, like I'm not me as a therapist when I'm out there in the world. Like this, it's a job, it's a role, and it's different. But a lot of people don't get that. And now I would say more than before, you're held to that standard. Like you can't say certain things online because you can get exposed and called into the ethics board and committee for having XYZ views. So I really, I didn't have to deal with a lot of that because I got out before all of this ahead of time.
To help me a little bit, and probably my listeners, because I'm certainly a layman. What exactly does it take to be a therapist? Like you're licensed and you're subject to a code of ethics and you're accountable by some higher power?
Yeah. So there's a few different avenues that you can take. I took the counseling avenue. So that's different from psychology. A lot of people don't know that. So the counseling field is actually through education departments, not departments of psychology. So I don't want to get too much caught up in to the nitty gritty, but ultimately psychiatry was the, more Freudian, medical model. And then psychology was birthed as an adjunct to that. You still had to have like a PhD level of education, but your function was a little bit like a step down from being a psychiatrist. And they did a lot of the testing. So then they needed, or I wouldn't say they needed, but then they birthed counseling as a field. So counseling is supposed to be a step down from psychologists in regards to the psychological assessments and the clinical aspect of treatment. So counseling was created to be more of a person-centered approach, that we did a lot more of the I like to call it the hand holding, the comfort, the empathy, the talk therapy stuff. And so oftentimes in a best practice team, you'll have all of those parts in place. So you'll have the psychiatrist, psychologist, a counselor, and then maybe somebody else at another level, right? So that would be your treatment team. And then you have all elements in place. And that would happen when you're in practice. But ultimately, to get to the counseling license, you get your master's, and you can stop there if you want. I didn't. I went on and got my PhD. So you can stop at the master's, focus on your licensing, and then that's another couple of years, 3,000 hours, comprehensive exams, supervision, internship. I mean, it's very exhaustive, but it varies depending on which program you go to. And for my doctorate, that was an additional, I want to say that was an oh my gosh, 14 years total. Is it really that long? I started my doctorate in 2004. And I matriculated, finally got my PhD in 2014, and that was post-masters. So I ended up taking the long route, but that's a whole nother story. That's not normal. Mostly you will just, most PhD programs are probably 4 years, I would say, give or take, but mine took a ridiculously long time. It was very traumatic, but some people have traumatic experiences like I did as well. So that is not totally novel. But in my case, there was a lot that went into it. So leaving the profession wasn't an easy choice, which it isn't usually an easy choice for most people. But you can never take away the PhD. I mean, that's not something that changes because I stopped practicing, meaning I'm not licensed anymore. So retiring from clinical practice meant that I retired my licenses. So I had 2 licenses, one for marriage and family therapy and one for mental health counseling.
So it's a lot of work that you put in to get those licenses, those credentials in order to be a therapist. And when you were on the board in the Cayman Islands, the mental health board, what exactly were you doing? And did you require those licenses to serve in that role?
Not everybody on the board is the Mental Health Commission. At the end, that's what we created, because we actually were working for the same Ministry of Health, on a mental health task force. And that encompassed, I don't remember how many people there were, let's say a dozen or so, like all sorts of people, a cross section of people. And that was kind of set out in the policy, right? Like you had to have like laymen, so many professionals, so many business people. And so I represented a clinician, like a mental health practitioner.
Okay.
And I was very active on this mental health task force. And as a part of that, we developed, like actually wrote the law to establish the Mental Health Commission. And so then I was appointed into the commission as the deputy chair.
And so were you in charge of what type of policies exactly, like how somebody would qualify for a license, or what the ethics were?
We weren't exactly the regulatory board. It was something different, but we oversaw the regulatory board, if that makes sense. So the Mental Health Commission specifically oversaw all things mental health in the country. So we rewrote the law, we established the commission, we were writing the mental health policy, we were advising the regulatory board, we were trying to connect all of the players together so that, everything was siloed, and we were trying to be that guidance that would create consistency and transparency through our systems to create a better infrastructure.
Okay, cool. That sounds like it was a beneficial endeavor.
Yeah, absolutely.
But I kind of like the reason I was bringing that up was because it seems to me that after dedicating like close to 2 decades of education that was extremely challenging, like you said, it was traumatic, and having those hard-earned credentials, you could easily have fallen into, let's say, like a gatekeeper mentality where you would expect other people in the mental health field to go through the same rigorous training as you, and perhaps you would see somebody as who is offering coaching services as outside of what is proper and what is safe, and could contaminate the mental health arena. So why didn't you turn out that way?
Well, I think I had my experience in that sort of mindset, like I remember when we brought in like representatives from local coaches, and we went through a whole series of meetings with them to try to understand what they were doing and how they were organizing themselves, and if they had any of their own best practices or whatnot. And in my country, the Cayman Islands, it's so small, right? So if you have the population is usually roughly around, like, let's say 65 to 70,000 people. And if you take out like the young and the old, then you're left with like even less, let's say, I don't know, 35, 40,000 people. And we were getting more and more mental health professionals, which is great. But the regulations on mental health professionals are so strict, between marketing restrictions. There wasn't any there wasn't any online telehealth like regulations. Like there wasn't approval for that. Like you could be, violating ethics because it wasn't an approved practice, but also just physically getting a venue, like getting a facility, because this is strange and hard to explain, but the way that our systems were worded, they didn't see it as a business first. They saw it as a medical practice, right? So if you rented a little room as an office, as a therapist, they had to come in and regulate that room like it was a hospital clinic.
Okay. Yeah. Makes sense.
Right. So
it doesn't make sense, but it makes sense.
You understand what I'm saying? Like why it was so tricky, because when I went solo, like when I left the practice that I was in being employed and I went out on my own, I had to get a room. And in order to get a room, I had to get it approved as a medical facility. And so all of that costs money. It's paperwork, it's time. It doesn't make any sense. Like it's illogical anyway. And my hands got tied because I was like, I'm working online and you're making me rent a room and then qualifying it as a medical space so that I can just have it. And I'm seeing people online, and it just didn't make any sense. Right. So that was also one of the reasons why I was like, you know what, I can't live like this, because I'm spending all this money that I don't have and I'm not making anyway. But anyway, my point, going back to the way things were run, is just, it was kind of like trying to get the whole framework of mental health practice up to modern standards of like how things actually function. And in order to do that, you had to rewrite every law. You had to go back, and it's just very cumbersome in my country. It's a bit different here, right? But not totally. Like there's still some overlaps, but
sure.
I don't know if you can imagine or picture what that was like.
Right. So at least in the Cayman Islands, it seems like the flaw in the system is that it was just so much red tape that was perhaps there for good intentions, like to uphold a certain standard, but it just made providing mental health services just way too prohibitive, and it was hard for you to provide value.
Yes, you're great at summarizing my long-windedness. Thank you.
No, I couldn't do it without the info.
So the other part you asked me was about the coaching, right? Yeah. And like if I ever felt this gatekeeping instinct. And I did. I absolutely did, because I was resentful at the time, because my hands were being tied. I was given all this red tape. In good faith, I was only trying to do what anybody would be trying to do, but they were making it so hard to even just make a living. Like literally, like there was no money coming in, and I was expected to pay all this money out on the licensing, on the regulations, on the fees. And so I was a little bit resentful at first when I could see all these coaches having a flourishing business, helping people in the same kind of capacity. And I mean this with a lot of nuance. So understand there's a huge distinction between therapy and coaching, but ultimately my population that I worked with was often high functioning people. I didn't my scope was not like the high, I mean, there was a time when it was, but when I went out on my own, I didn't want to work with people who were highly disturbed. I only wanted to work with people who were highly functioning anyway. And so I started to refine who I wanted to work with and realized as a business model, coaching just fit better for me, because then I didn't really need a license to just work on, goal setting and relationship development and stuff like that with people that were going to be hiring me. I really just needed to serve as a consultant or a coach, whatever you want to call it.
Right. And so the coaches, both in the US or the Cayman Islands, I guess there is this idea that they're providing a mental health service. And how do you control the quality of it? But
they're not.
Okay.
They're not doing a mental health service. So this is, like I said, mental health professionals treat pathologies. So pathologies are any diagnosis that you would have in the DSM-5. So that could be generalized anxiety disorder. That could be PTSD, bipolar disorder, schizophrenia, whatever the diagnosis is or could be. They're treating that particular illness.
Got it.
And in order to treat an illness, you can do generalized talk therapy, or a lot of people will go to an actual, like a clinical psychologist to do psychological testing, but then also to do like a prescribed treatment model. Like if you've heard of EMDR, DBT, CBT, like there are clinical models of therapy that you would be going through as a client. Okay.
So does that involve like pharmaceutical intervention? I don't know what those abbreviations
are. Cognitive behavioral therapy, dialectical behavioral therapy. EMDR is eye movement desensitization and response, I think. So all of these things are very specific, and you have to have credentials in order to do them.
Gotcha. Okay. So I was kind of using mental health services wrong earlier, because I thought that could include coaching. But if you're helping somebody who perhaps like needs dating advice or like career guidance, that is not what is generally understood as mental health service.
Right.
Okay.
Exactly.
Gotcha.
Exactly. But the thing is, and this is something that I wrote down to mention today, is one of the problems systemically, like, I mean, not just in the institutions, but socially, is the reaction, like, let's say, I don't remember what decade it was when they deinstitutionalized people. Like there was a time when the mentally ill were treated as second-class citizens. It was really shunned if you had any kind of mental illnesses, right? Like back historically in the day. And over the past several decades, they really tried to normalize mental illness, right? They wanted people to not be afraid of it. They wanted people to talk about it. They wanted people to seek help. So counseling especially, but all of the mental health fields really tried to educate the public to normalize it. I mean, this was explicitly done. Their intention was to make people more comfortable and have services more accessible to people. And it went too far, right? And over normalizing it, they have taken away like the self-accountability where everything is a disorder and having a disorder is totally fine.
Right. Yeah.
Instead of looking at it more as a spectrum issue and seeing it as actually like maybe 20% or less of mental illnesses are organic. Most of them are lifestyle related issues. They're behavioral issues, and they're in your control to change.
Mm-hmm. I remember in college reading Girl Interrupted about a young woman who was institutionalized back when they had institutions for people with mental health pathologies. And it was very clear that she could not function like a normal person without help. Um,
Mm-hmm.
but now I think when people hear like the term mental health problem, it could be any number of things that are stemming from stuff within your control. That seems to be the case, right? So there's a conflation.
Yes, absolutely.
Yeah.
I mean, there's so much going on. There's so many examples that I could think of that now I'm flooded that I can't think of one, but I call it
Sure.
like toxic victimology, you know,
Right. Yeah.
everybody's playing the victim. And even just the first thing that pops into my mind is the gaslighting thing, right? Like the concept of gaslighting is so misconstrued by layman's terms. Like it's applied inaccurately. So
Mm-hmm.
just because you disagree with someone, or just because you have a staunch stance on something, or you're very rigid about your beliefs, or you're questioning someone's perspective, does not mean you're gaslighting someone. But there's also divergence among various mental health professionals on this as well, right?
Mm-hmm.
Because of our own personal values. So it's hard to like now say what's true and what's right, because there's so much diversity happening. But ultimately, gaslighting abuse is about power and control. It's about someone who wants to break down your own sense of self and your psyche, your own identity, in order to get what they want from you.
Yeah.
Right? That's the intention behind gaslighting. So a lot of people are using and throwing this word around a lot. And the reason why I used it earlier is because I do think a lot of this posturing and political game playing is intentional. I think they're intentionally trying to create confusion and chaos in the population. And that would be gaslighting, right?
Mm-hmm. Mm-hmm.
So yeah, anyway, that's just one example, but there's many.
Right. Right. Yeah. I see this word used all the time. Like if a political figure that somebody doesn't like says something, they'll say they're gaslighting us. But it's almost like denying, like you said, there's objective truths in the world, and in a completely relativistic society where the only thing that matters is my perspective on things.
Mm-hmm.
That's the only thing that's valid. Everything is kind of destabilized or
Yes.
disintegrated.
Yeah.
You know.
Yes. Yeah, that's exactly right.
Right.
And when it comes to maybe, I mean, I don't know. I'd like to think that people don't always know that, like, they're not being malicious. But if you look at it realistically, like, it's like someone is putting this out there intentionally. The indoctrination that happens to people in the field, right? Like it's so subversive. It's so like, what's the word? Implicit. It's not made explicit at all when you're looking for your master's and doctorate programs. Like, yeah, okay, so I went to like 2 Catholic universities, so I knew that the values would be skewed towards maybe some things religiously.
Mm-hmm.
But when it came to the actual counseling program, I didn't realize, like, maybe that counseling, psychology in general, was so heavily influenced by feminism, by progressivism. It's so anti-patriarchy.
Right.
It's the very, very postmodernist, social constructivist mindset. And you had to learn it. Like, it was drilled into you to get it right and to apply it correctly, or you fail.
So there's no room for error if you want that degree or if you want to pass that class.
Absolutely. And it gets worse and worse the closer you get. And you have the what do you call it? Like the sunken costs, right?
Yeah.
You're spending all this money. You've got all these years and all this hard work writing on it. And the reason why mine was traumatic, my experience just in doing my research. The coursework was great. I mean, I was a philosophy / psychology / sociology major in my undergrad. So I was all into, those discussions that we had. But once I realized that I couldn't actually think for myself and have my own opinions, it had to align with their views of things. I wrote probably about a dozen different doctoral topics.
Mm-hmm.
And I had 4 or 5 faculty advisors. One died, one was fired, one kind of lost his mind. One was too busy. And then finally, the last one helped me finish. But ironically, my doctoral dissertation was on the sexual abuse, counseling sexual abuse survivors in the Cayman Islands, the experiences of mental health professionals. And a lot of the literature and the punchline was these systems of, it's like objectifying relationships based on a patriarchal system cause like this social and cultural dynamic of abuse. And so that was the only one that they would support me in really writing and finishing. So then I have to stick to the script. And it was through the process that I realized, there's a lot more nuance and things going on here. And now I mean, I'm glad that I did it and I appreciate the work that I did, but it's definitely not what I think now. Yeah.
You kind of had to speak their language just to get through.
Yeah.
Yeah.
But, I shifted in a lot of ways, like post, getting all of that accomplished. So when it comes to feminism, like I really had an awakening out of feminism that I didn't even realize I was in. And that went with a lot of progressive thoughts and they really drill like social justice issues and that whole, I won't say like socialist mindset. They really drill that into you in a lot of insidious ways. Like you don't realize that you're absorbing all of this. And it's your life. It's your 360 life for however long it takes. And then you kind of just iterate that every day. Right?
Do you think any of your fellow alumni, people who go through that system that is kind of indoctrination with the feminist ideology, the kind of the progressive ideals applied to the mental health field, do you think they ever kind of evolved the way you did? Do they start questioning some of their assumptions that they picked up in college and see the light?
Not as many, but there are some. Yeah, some I didn't go to school with. Some it's just peers that I've met since, people who share experiences or beliefs and, went through their own period of cognitive dissonance and then realization of integration, coming to their own happy place. So I'm very optimistic that it's happening more now. Actually, here's a good example. I fell out with a close girlfriend of mine who I went to my master's program with. Like we went to the same master's program and we maintained a very strong friendship, but we had a falling out based on like values. And she just surfaced and I find out she retired.
Oh, okay.
Yeah. And so you see how it goes hand in hand is like, so for her own reasons, and I won't get into that, but when you shed that identity, other things start to click into place and you start, maybe not being so aggressive about certain values and social justice issues. And okay, maybe, the relationship here is more important. Maybe we can be tolerant with each other. And this doesn't have to be a divisive thing, but it takes that separation of, separation from the identity of the work to actually helping people. You need to focus on, who you are, being authentically you, and how can you help people, and realizing you don't need the profession for that. And the profession is doing some harm. And I think a lot of that harm is actually being done to the professionals. They're creating the professionals' mental ill health.
Yeah. Wow. That completely speaks to what I'm trying to investigate with these fallen institutions, because if we rely on mental health professionals to treat people with problems in our society, but the education system that produces that mental health credential is captured by a, a wrong ideology, by a false worldview that demands conformity of the students, then it's not only failing all the people who need actual, like, objectively effective mental health services, but it's also doing harm to all those people who go into this career, who have to believe something that they may not necessarily believe, who have to violate their conscience, or in your case, be a little less authentic just to get a thesis approved or something like that.
Yeah.
And then, like you said, because of the ethics, they have to be 24/7 on and in this mindset. They're constantly forcing their own minds, I'm sure, to kind of agree with things and to like the cognitive distance. I'm sure it's like amazing. And if you ever start to question it, you're threatening your livelihood, right?
Yep. That's exactly right.
It's kind of scary. Like, when I kind of started this podcast, I was like, okay, this might be a little conspiracy theory. Let's do some digging. But the more I talk to people, the more it's like worse than I could have imagined. And it's more obvious.
There's some examples, like even lately on Twitter. I don't know if you were there when therapist Twitter attacked me.
So was this about your opposite sex friends tweet?
It might have been. There were a few back-to-back major tweets that got like a lot of vitriol, but therapist Twitter came at me with venom. And ironically, there was this whole and I'm trying to engage and be civil with some people. I give people reasonable doubt until I can't anymore, or it's just already like a mobbing, and then I just block 1,000 people.
Yeah.
But this particular crowd and therapist Twitter, I was trying to have good faith with, and this guy kept pulling up the code of ethics and telling me that I was violating the code of ethics. And I'm like, sir, I know you mean good and well, because I have spent many, many years when I was serving upholding the code of ethics.
Yeah.
But the code of ethics does not apply to non-healthcare professionals. It doesn't apply to coaches. You're trying to make me follow the rules of like healthcare professionals, people who are licensed. And he couldn't get it in his head that it didn't apply to other people. And so that gatekeeping mindset, it's a skewed one. You assume it's like an egocentric perspective where everyone's supposed to follow your rules, but that's not how it works. If you're just an independent person and you're not a professional and you're not defrauding anybody, you're not pretending to be a professional, then you're just a business owner, and it's ruled by capitalism.
Yeah. Do you remember what he was talking about? Like, what was the violation?
I don't really. I think it was, I don't know. I'd kind of be guessing. I don't really remember, but it didn't make any sense. And I was trying to give him reasonable doubt. I was like, can you please explain to me how this is how I am violating the code of ethics that only applies to licensed practitioners? And every time he came back, it was clear that he had no idea that it didn't apply.
Right. Yeah. Crazy. Well, it sounds like you landed in a good place because you're able to help people as a coach.
Right.
But it is funny because I do follow you on Twitter, and you're not saying anything that's like that outrageous, and yet you do attract a lot of controversy. It's funny. I listened to your interview with Pat Stedman, who's another coach, a really unique thinker, a sharp guy, and I think you said something to him. You said you're becoming a lot less mainstream. I think it's probably not you who's changing. I think like the culture itself is a little bit more unhinged and unwilling to like accept truths, because let's go back to the example of what you said about it being imprudent for somebody who's in a relationship to start making new friends of the opposite sex. Like, I get what you're saying when you say that. It's challenging because it certainly would hold people to a higher standard of personal conduct. Like, you kind of see perhaps like somebody in a relationship, like they have like maybe a woman has like a guy in the wing who's kind of hovering, hoping that the relationship fails so that he could swoop in. Like if the woman has an argument with her boyfriend, then she can always, you know, complain to this other guy, and the guy will just affirm whatever she's feeling just to kind of gain that, you know, upper hand over his rival, his perceived rival. So I see situations like that. And so with that dynamic in mind, and with abundant evidence of it happening in today's culture, I see the wisdom of encouraging people to not do that. It's the type of like advice that you would, like an old school grandmother would give, you know. Not saying
me.
that.
No,
Yeah, exactly. It's just like, it's common sense folk wisdom. And yet you get so much vitriol from I guess therapy Twitter. I didn't know so many of these accounts were actual therapists, and it makes
and
me
disability Twitter.
right. So that's another thing too.
But with the opposite sex friends thing, I mean, the nuance, it's just the nuance is lost on people, and not everybody, but these particular unhinged people that react emotionally before they stop to think, use critical thinking skills, regulate their emotions, and engage in good faith conversation. So instead of understanding the message, it's about single people, right? Like if you meet a single man, if you're a heterosexual person in a monogamous relationship, and you meet a new person who is single and of the opposite sex, it is not prudent for you to go hang out one-to-one with them on the phone or get to know each other. It just doesn't compute. Like that's a date. You don't date other people if you're in a monogamous relationship. Now, if you have a purpose for getting to know them around a context, like if it's a work scenario or if it's a hobby or an interest that you have, if they respect your partnership, if your significant other meets them, feels comfortable, feels respected, you check in with them, you let them know, oh, I was talking to so-and-so today about XYZ, and you develop trust around that, then that's one thing. But it's not you trying to develop an intimate relationship, an attachment, and a bond with this person. It's you're an associate, you're a peer based on a certain purpose or context. That's when if it's a new person, how you do it. And especially like if you spend time with your significant other around them, if they're not single, that's great. Then you can bring in their partner into the mix. You can be couple friends. And that's what I share with people and how I teach them how to navigate that to preserve the relationship boundaries and maintain proper relationship ethics. And all of what I teach is about preventing problems, because then what happens is all these people who protest, like figuratively to me, they then at one point just it ends up happening to them that there was a violation of boundaries, betrayal, affairs, the shit hits the fan, and then they go to see a counselor to try to resolve it after the fact and try to treat it. But I mean, isn't an ounce of prevention better than a pound of cure?
Yeah, exactly. Yeah. And it seems like that's what the traditional age-old wisdom is there for. It's to prevent those problems before they occur.
Yes. I mean, and even just saying your relationship should be your priority, like it should be your number one relationship priority in your life, gets a lot of pushback because, oh my gosh, that's so codependent. How could you as a therapist, like this is what people will say. I'm like, I'm not a therapist anymore, so I can actually say what I want. Right. But yes, if I were a therapist still, I would be held accountable for saying some of these things because it goes against the rhetoric that, you know, it's maybe codependent in the general eyes of mental health relationship services, right? Like in marriage therapy or whatever. Like I would have to apologize for maybe saying something inappropriate. But anyway, it's not codependent to prioritize your relationship above other relationships. That's just common sense, that you can't put your parent ahead of your spouse. You can't put your best friend ahead of your spouse. That doesn't mean they're not important, but you can't diversify your attention and your priorities like that. You only have so much bandwidth. And if you want to make your marriage successful, it has to be your core focus. And that includes your relationship with yourself above that, right? Like if you're not healthy, your relationship's not healthy. So it's subsumed in that. But compared to any other relationship you have going on, you can't be consulting with your friends or whomever over your spouse.
Yeah. That's amazing that you'd be violating the code of ethics if you were to say that.
Well, it's not so directly against the code of ethics. It's more like if I were to say things that people would call misogynistic, then I would get pressured into like having then being like any client could then say, this person was misogynistic with me. Then they could go to the code of ethics and say, I was mistreating them. And then it would be a whole debacle. You'd have to respond to the code of ethics. You got a blacklist on your name. I never had any problems ever practicing because I never, it was different. Mm-hmm. Once I got out, I was able to speak my mind more freely. And I started to shift after I left the practice. Like it was like, I knew what I needed to do in order to be congruent and authentic. And so I made the step, I did the steps, the action steps that I needed in order to take that route. But before, I was split like everybody else was. I was kind of performing when I was doing therapy, and it was unfulfilling to me. Mm-hmm. I felt like I had to do what they would expect me to do and not necessarily what I thought would be most helpful to my clients. Now, this isn't to say I wasn't helpful to my clients and I didn't do good work, but something about it felt like just inauthentic. That's the best way to explain it.
Mm-hmm. Wow. I think that is the problem with what our culture today. People are prevented by artificial means from choosing the highest value, like no matter what. It could be like in economic terms, like if you're a business owner, you can't make sound business decisions because there's layers of regulation or artificial supply chain crises or currency manipulation. It's so funny because a lot of sound philosophy is coming from like crypto bros because they think, it's like
emotional regulation.
Yeah.
That's exactly it.
Right. Yeah. And they see that when a government can do price controls over fiat currency, that's them interfering with how people naturally determine value. And it's just yet another way in which we have to walk around with cognitive dissonance. We have to put up with hypocrisy. Like if the purchasing power of $1 is not what it truly actually is, then that's a little lie you're telling yourself. And that's such an abstract way of doing it. Like it's so much more like, here we're going to get controversial, but to say that, a boy can be a girl and a girl can be a boy, and like your sexual identity is so interchangeable like that, they have to create this term gender to it seems to have led to a lot of suffering and a lot of
ambiguity.
Yeah.
Yes. And having an objective framework for what is healthy and what is unhealthy is an essential role of being a healthcare provider in any capacity. And it was a lot better before I left, but I definitely saw it deteriorating. And I remember working specifically with a family and an adolescent who identified as non-binary. And so this was a few years back. and even then, like that was the whole purpose of me doing therapy with this adolescent and family, was to address their identity of being non-binary. And I could see the direction that the profession was going. We had a successful outcome, but I had to, really challenge myself to like examine some of these issues. And the only ways that I could do my job was really to believe those values, if that makes sense.
Yeah. Yeah. I think our society, well, I mean, this has been true for centuries if we're talking about like Western society, but it seems we are so gung-ho on tearing out like religion and any reference to God and spirituality from our society. Like we want a purely empirically based world, you know, like if you can't like determine it through like the scientific method, then it's irrelevant. And so I think you can't do that with discarding our wisdom traditions. And I think wisdom is how we know like what is up and down in terms of what is good and bad. And right. I think like when you're giving people life advice, you kind of do need that up and down. And that's what we've thrown away.
Yes, exactly. So now I feel empowered to be very clear about my values, and my clients find me. I don't, you know, it's not a passive thing, but like I put my voice out there, I make my personality and my principles known. Yeah. So when people feel aligned, they seek me out so that they ask for my particular guidance based on who I am as a person, knowing that I also have this formal education and experience to back me up as someone who knows what they're talking about and has, you know, just professionalism, period. So I have this nice blend of all of that. And I call it the way that I, you know, sort of sit in that sweet spot, like a good balance of logic and emotion, or science and art. It's, I think it's an integration. Like you mentioned before, like what's the problem that we see out there is disintegration. Yeah. But what I have come to is my own integration of all of that. And the professions are not going in that direction. That's for sure. So
yeah, that's discouraging. We're coming up on an hour. Do you have a little bit more time?
Sure. Yeah. I'll have a couple more minutes for you.
Okay, cool. So I'm interested in you as the coach. So you're working with clients. You do a lot of relationship and vetting coaching. And so those are all about helping people find their romantic partner. And so I see in this culture, in my own personal life, like a lot of single people right now, like great people, in fact, are finding the dating world dismal. You know, it's really discouraging and frustrating out there. So why is finding a mate so hard in the modern world? And why is it so hard for so many people?
Well, I think there is a lot of this cognitive dissonance happening on an individual level. But for women, I would say I've really been countering the narrative of date around. Like a woman needs to date around. And I honestly, like, I think the sexual liberation and all the sort of derivatives of that got us to that point where women can do what men can do, right? That whole feminist mindset as well got us to that point. And that's literally the pushback that I get when I counter that. And I say, no, do not date around. This is totally backwards. And here's why. And then they'll be like, well, men do it all the time. So of course I'm going to do it too. I'm going to protect myself. So I'm going to do what they do. And so this mindset is very immature. It's very childish. It's obviously it's dysfunctional. It's hypocritical. It takes no accountability for oneself. So instead of stooping down to the level of the thing that you're the problem, right? You should be called to be better. And then knowing that having higher standards for yourself, having higher self-respect will allow you to attract someone with the same level of standards and behavior and self-respect. And yes, it might be fewer people that have higher standards, the quote unquote high value person, but to be exceptional means that you rise above the fray. And so a lot of people lower themselves or stay there. Not that they were ever high, but they just sort of stay at this, you know, mainstream level of, you know, what everyone else is doing,
Right.
because of the instant gratification, because they're feeling lonely or dissatisfied or lost or unhappy. And so they just want that fix, that pleasure. They need the dopamine hit that we've gotten used to with social media and notifications and just being overly stimulated. And so that is transferred into our relationship systems, right? Where we constantly, like, every text message needs to be responded to ASAP. If your friend like goes MIA for a few days, then it's the end of the friendship. They're ghosting you, right? Like, that whole mentality, I think, is the main problem. And so with all those feminist and progressive influences on female behavior and making them act this way, trying to correct that. I mean, it's tough, but case by case, I'm definitely reaching people. And it's funny because a lot of times I get criticized for being too hard on women and always sort of pointing the finger at what they're doing wrong. But honestly, I see a lot more wrong with women's behavior than I do with men's behavior. And I also just work with more men. And so the way that I create content, it's based on authentically on the work that I do. So it's a derivative thought, usually, of something that's a pattern with the people that I'm working with.
Yeah.
And so if I worked with only women, I'm sure it would be more, you know, in the reverse. But a lot of the women don't come to get help because they have a hard time with the masculine side of being objective, taking instructions. They want a lot of the hand-holding. They want a lot of that. I call it emotional yoga. They want the comfort. They want the validation.
Right.
They don't really want to look at what they're doing wrong and fix it.
They want what they're doing currently to be affirmed.
Yeah, exactly. And so that's another way of describing the way counseling has been characterized, is that very feminine, coddling support for people, rather than being more specific and explicit about what's right and wrong, what's healthy and unhealthy. And because of all the sort of social virtue signaling stuff, it's like, you're a sexist, you're a racist, you're an ableist, you're a whatever-ist, if you have that objective standpoint. And that's when the shit hits the fan, you know, on your reputation professionally, if you start getting labeled with all those isms, and then the board gets called in and you get complaints and yada, yada, yada.
Right. So it's just too dangerous for a therapist to even go there.
Right. So a lot of times what I've seen and what I see by far, like from afar, is that a lot of therapy is enabling and just a lot of that hand-holding. It's not actual clinical, you know, what it should have been, the science behind mental health treatment. A lot of it is just therapists playing anti, or whatever you want to call it. They're not actually doing a lot of therapy. They're just doing a lot of that affirming.
Wow. I'm a huge fan of Jordan Peterson, who sometimes talks about his experience as a clinical psychologist and how his goal was to always make somebody stronger. Like if somebody had a problem, like a phobia, he used an example once of like somebody who he worked with who was definitely afraid of elevators. And what he didn't do is say, yeah, you're right, elevators are scary. He had like a gradual exposure process where, like, let's just look at the elevator. Maybe next week you can press the button, but not go in. And like after a while, he was able to help this client, overcome that fear.
Yes.
But it did demand kind of facing fears, but also that it imposed a standard on him that what you're feeling right now is not the place to be permanently.
Well, right. And that's a very classic textbook technique. I think it's called systemic desensitization.
Oh, cool.
Yeah, so that should continue to happen. I'm hoping that like all these classic methods and techniques are still happening in therapy, but what would change is what is defined as a phobia, or what is defined as that problem. Like the technique would remain, but like, can you really call, like, what is it, that you need to resolve? That's like, I think some things are now off the table. Like, I don't think you can identify certain things to fix them, because it's crossing some kind of ethical boundary now.
Right. So if client had like gender dysphoria, which I think itself is probably considered a politically incorrect term, but if you think that you were born in the wrong gendered body, then back in the day, perhaps a therapist would perhaps try to help you feel comfortable again as your biological sex, but now it's affirming the desire to be the opposite sex, let's say.
I won't even use that as an example, because I think that one is a little bit more, I don't know, different class there. But one that's probably more simple is a woman who is not complaining about any kind of negative effects of casual sex, but she's got a lot of like instability in her life
because of that behavior.
You're right. And because she's just carrying on, she comes in and she just talks about this hookup and that hookup and all this sort of stuff. If unless the person brings you that issue, now you probably cannot address it without being accused of being what's the word I'm thinking of? Like prejudicial or something,
or
right?
Shaming.
Yes, exactly. Shaming them. So it's not always, it's how you do it, right? Like if a person was like, treating you in a way that was shaming or derogatory or something like harsh and volatile, like I think that'd be different. But if you're just obviously you have to have rapport and trust and everything like that, but in an appropriate way, if you were to confront, there's not a lot of confrontation happening in therapy anymore. And you were to say, do you think that this is like a healthy choice for you to be doing this? Do you notice any like negative impacts or influences from this pattern being perpetuated in your life? Do you see any, like calling that out is a lot more dangerous now. People are afraid to even go there.
Right. Wow.
Because then they're like, well, it's my body, my choice. Like, what's wrong? That's what the whole world is telling me. Like, I can do whatever I want. Who are you to say that this is unhealthy?
So like the mindset, or I would call it an ideology, but let's say the body of values that would insist that mental health professionals affirm the my body, my choice mentality versus maybe re-examine what you're doing here. Like how does that get started? Like how does the entire field get goes along with this body of values as opposed to this other body of values?
I tell you what needs to probably happen is something like the Johnny Depp Amber Heard case.
Yeah.
We're going to have to see a lot of very visible, I don't know if it would go to what if it goes to the code of ethics, it's very internal. But if somebody went more civil with like these accusations, right, it's going to take a scapegoat or two, right? Like people are going to have to be under the microscope. But if we had some high profile people defend themselves, and then the world on some level, whether it was televised or not, probably, but like at least if it was exposed on social media or whatever, and they saw proof of, how whatever the claims were and how they were false and how it was misconstrued and how professional this person was, we're going to have to see visible evidence of that playing out, kind of like the Johnny Depp Amber Heard case, right? That's the only thing that's really brought this to people's attention, that like a woman can be so full of shit and turn things around like this on someone, and having a man be able to win in court is a big thing.
Right. Got it. What are some of your inspirations? Like, what helped influence and shape your school of thought when it comes to these matters?
It's hard to say. I mean, my father, that's kind of cliche, but my father was very opinionated. He was very highly educated. My dad was a Oxford Rhodes Scholar.
Oh, wow.
He was a OBGYN. He built his own hospital, like ran his own hospital in Jamaica for many, many years. He was very acclaimed. He was a doctor for 50 something years, recognized by the American Medical Association and the Jamaican Medical Association or Caribbean Medical Association. And again, like lots of experience as a little girl, hearing him talk about political values, principles. He wrote a lot. He wrote, like, he was old and it was back in the day, but he wrote like newsletter articles, and we used to have his articles print framed on the walls. And he was talking about like abortion. Actually, abortion was a big topic for him as an OBGYN.
Right.
But he was it wasn't really a pro-choice or pro-life thing for him. It was more a necessity thing, a medical necessity. So he really argued and advocated for abortion as a means of medical necessity in a lot of sexual abuse and incest cases. So, people, it was controversial back then, but I knew my dad was very vocal about what he believed, and he acted on it and he spoke up about it. So I think that, that as cliched as it's true, like he really influenced me in a lot of ways. But I think, yeah, it's hard for me to pinpoint. Whenever I'm asked like female role models, it's a tough question. We don't have a lot of female role models, at least for people. Well, I mean, there's, people like Maya Angelou and, lots of Ruth Bader Ginsburg, like that people throw around. But I think for what we're talking about, there's not a lot of examples out there. A healthy, integrated woman is hard to find.
Yeah. All right. One more question to end on that's kind of related to that. Like, let's say there's somebody who's watching and they're not having the life that they want. They want to have that end goal of being healthy, integrated, to have that life that they want, but they don't even know where to start. What would you say to them?
Oh, gosh. That's kind of like a hard question to answer, but I think because most people are on track on some level. Like I have this saying of, don't try to heat up the cold spots, work with the warm spots. And so that's why I don't engage. I don't try to change people's minds. A lot of people really spin their wheels trying to change people's minds, but they're not, it's just a waste of breath. It's a waste of time. But if you see like that spark in someone where they're questioning things, or they're looking for another alternative, or there's just something gnawing at them, that they're not content, they're not on path, right? Then they'll usually reach out and take that initiative. So I'm going to use that, like just contextualizing what you said a little bit more along those lines. When someone reaches out to me and they have that sense of determination, like they really want to commit to personal growth and change, like that will is there. I mean, the self sort of inventory is so important. Really being honest about your patterns, your previous experiences, your child's, you don't have to go into like, psychodynamic stuff and Freudian stuff about your childhood, but knowing like your general attachment style, knowing what are your sort of weaknesses or toxic traits or shadow side, whatever you want to call it. It's important to confront those things. And if you don't have if you can't have hard conversations, if you can't communicate well, if you can't regulate your emotions, I mean, those are all the real, and boundaries too, like those are some basic fundamental aspects of mental, emotional, behavioral health that you need to look at. And so, I mean, it sounds also silly. I mean, very, very self-development Twitter, but some of these basic systems of general health, creating routine and consistency in your life, creating discipline and accountability, being able to always focus on health first. Everything stems from your basic health. So if you're not eating and sleeping well and getting your movement in, your sunshine, really cultivating healthy connections in your life, creating that support system that is objective and validating for you both, then you need to start there. But sometimes I did speak to someone the other day on a discovery call who was like in a tailspin, just like repeating really dysfunctional patterns. And what I said to her was, I think what you need right now is to isolate. So as like a really starting ground, like build your foundation from the ground up.
Yeah.
Start saying no, because she has so much toxicity in her life. So if that's where you're at, like you can't even tell if you're going to commit to your own growth because there's too many repetitive mistakes happening. The best thing that you need to do is get away from all the bad influences. And that gives you a sense of agency. Like, I can actually get out of this situation. I'm not a child and I'm not being abused. I'm choosing to put myself in these bad situations because it's just the life that I know. It's the community that I know and the people that I know and the day-to-day that I know. But if I just back away and regroup, reset, really do some self-study, and that can be meditation, journaling, again, just like going into your own health practices, that can really help. It really gives you, it's almost like when you go on a vacation by yourself, like pick somewhere that, you'd love to go and you got some stability. So it's a hotel or, you can just have like everything that you need in the surroundings. Right.
Yeah.
And so what do you do with your day when you have full control of your life and nobody else to worry about? Like, what time do you get up? What do you do first thing? What do you do in the hotel? Do you go down to get breakfast? Where do you go? Like really starting to intentionally create and design what make your life in a way that aligns with what creates health and success and ultimately happiness, which is what I define as peace of mind and health.
That's awesome. Well, it's so good that you're in the life of so many people who need that coaching. This was a really good conversation. So Taylor, thank you so much for speaking with me today.
You're welcome. I'm glad to hear that. I feel like I was very long-winded, but it was a pleasure. Thank you.
No, not long-winded at all. People need to hear these kinds of things and they need to know what the state of the world is like and what the state of mental health treatment in America or abroad is like. So thank you for sharing.
Yes. Can I say one thing?
Yeah.
I'm not trying to cop out, but I do want to say that there are some really good therapists out there who are trying to change the system from the inside or just do it their way from the inside. And I totally applaud and support them. And just to do your due diligence when you are in need of seeking a therapist, because you can get the help that you need and it can be effective, but you absolutely need to make sure that you align on some core things, that your therapist has enough courage to be authentic with you and to be transparent about some of these very controversial things, because otherwise they're probably not going to do you as much good as you'd like.
If you're searching for a therapist, what are some like green flags to look for when choosing?
Honestly, if you just get on the phone with them and have like a quick conversation, asking them some general questions like where was your training? What's your methodology or your modality? How do you do therapy? What would you say your core values are? I'm just curious, like life outside of therapy, like ask them some going on a slightly personal, but not inappropriate, right? I'm not saying ask them inappropriate questions, but see how they respond to those, because the ones that are like, I'm sorry, this is about you, I can't talk about me. They have very rigid ideas based on this, what we're talking about, incongruent, inauthentic, cognitive dissonance based approach to therapy. They're not going to be themselves in the therapy room. They're going to be textbook playing a role, wearing a hat, and doing the rote thing.
Got it. Well, hopefully people take that to heart and connect with the right people. And I'll make sure I put your information in the comment section. And
Yes.
to everyone who's listening, if you like this, please hit the like button and subscribe if you haven't. And thank you so much. Take care, everyone.